Hi, I'm JJ and I'm here with the fabulous Keren in Kirkcaldy, and she's going to tell us about a great new initiative which is a low-income clinic, a community herbal clinic which has just started. Keren, tell me all about it.
Wow. I'll tell you a little bit about what we do here. First of all, I'm a medical herbalist and we run clinics during the week with myself and another practitioner, Wendy Kelly, offering treatments for lots of different health problems. But there is a fee involved in consulting a medical herbalist, and although we're very competitively priced, it's still out with reach of some people's incomes. So we are looking at doing a community clinic to try and offer herbal medicine to more people, because I think there's a real need for that in this area. And at the same time, we're also supporting the herbal community because I have student herbalists doing clinical training with me, and they are going to be involved in running a clinic, and in fact will be taking the case histories under my supervision. So it's a community clinic for the people of Fife and a community clinic for herbal practitioners of the future as well.
Well, that's fantastic. So it serves both purposes.
Mm-hmm. Absolutely, yeah.
So it's a training clinic, but also it helps people on low incomes.
Yeah.
Now, some people watching this might be saying, what is medical herbalism? Why would I want it?
Herbal medicine is the oldest form of medicine that we have, so it dates back to, to the dawn of time basically. Man has always used plants, and there's a very long tradition of herbal medicine in this country. And actually up until the war, people saw their medical herbalists rather than their doctors because it was cheap to see a herbalist and expensive to actually pay for a doctor to treat them.
It's the other way around now.
It's the other way around now. So it's free at the point of contact with GPs. And herbal medicine did see a little bit of a decline after the formation of the NHS, but we're seeing a bit of a revival because we fill a gap where conventional medicine doesn't always work. So chronic problems, stress-related problems, where people need a little bit of guidance and support with a lifestyle, then I think herbal medicine really fits that area, because not every person gets better with conventional medicine.
Tell me, give me an example of one of the things that it might help where conventional medicine, as we now call it, doesn't help so well.
Well, take fenugreek, for example, this herb here. So fenugreek is a spice that's used in curries, but it's actually got really good anti-inflammatory properties, and it's very demulcent and soothing at the same time. So we use it for treating diverticular problems. Now, if you have diverticular, the issue is that can become diverticulitis, and then it can get really inflamed, but you want to work in a preventative way. So we can use things like fenugreek to try and prevent flare-ups going on and try and keep the bowel in a much healthier state. Whereas in orthodox medicine, they would probably give you something like fibogel to keep your bowels moving. And there's not much more I think they would really offer unless you were actually in an inflamed situation, and then they're going to bring in antibiotics. But much better to stop you getting into that place in the first place.
Yeah, so a lot of it's preventative.
It can be preventative, and it's also about joining up the dots for people. So people will often come and see us when, they've been to the doctor, they're tired all the time, they don't feel right, but all the medical tests say there's nothing wrong. And what we'll do is we'll go through a very detailed case history. We will basically go top to toe and try and join up what's actually happening, because often these disconnected symptoms are really connected to what's going on. They are connected, they're happening for that individual person. And then we can prescribe some tonic and restorative remedies. So we treat lots of bowel problems, skin problems, etc., where people just aren't getting better, aren't getting answers, and we try and get to the root cause of the problem.
Yeah, and as you say, this is ancient medicine in some ways, but you've brought it up to date, haven't you? I mean, these days you are fully trained.
We're fully medically trained, so my medical knowledge is on par with a GP, and there might be some GPs might think, what? But, I did 4 years medical science training, so anatomy, physiology, pathology, diagnosis, and we have to undertake 500 clinical training hours, which is what the students are doing with me, both observing me in my full clinic and now participating in the community clinic. So we're first of all trained to be safe. We're trained to look for red flags. We don't want somebody coming into our consulting room and us missing that they've got potential pathology. So it's about patient safety, having a really deep understanding of medical problems, but also understanding orthodox treatment, and then learning about the plants as well. So it's a very, very detailed study and training course.
And of course, a lot of modern medicine comes from plants.
Yeah, absolutely. Now there's one on the table here. We've got meadowsweet. I'm sure it's on the table. Stomach ulcers here. Yeah, meadowsweet. So meadowsweet. Everyone thinks about aspirin as coming from willow bark, but actually the first isolation of aspirin compounds were actually from the meadowsweet plant.
Didn't know that.
So meadowsweet botanically is known as Filipendula ulmaria, but it used to be known as aspirea, and so aspirea gives us aspirin. Yeah. So here this is a wonderful example of how things are a little bit different in herbal medicine compared with orthodox medicine. So we all know that aspirin's a really good painkiller and it's anti-inflammatory. But what aspirin does is it can really irritate the stomach and there's an increased risk of stomach bleeding when you take it. Now what we have here, Mother Nature being very clever, is a plant that gives us the aspirin-like anti-inflammatory compounds. So we can use this for treating arthritis. But one of its main indications is treating stomach ulcers. So it actually soothes the stomach at the same time. So it may be less potent in the short term, but over the longer term, it's probably more potent because you can keep on taking it. It's not going to cause the same sort of side effects. And so, yeah, that's a great example of how orthodox medicine and herbal medicine could be possibly related. They do isolate a lot of plant-based chemicals.
Yeah, and in isolating the plant-based chemicals, aren't they tending towards creating an imbalance? Because you might treat the symptom, but then you create imbalances elsewhere. I mean, do you find that that's less of a problem with herbalism?
Yeah, with herbalism we tend not to get cumulative side effects, whereas orthodox medicine there are more risk of side effects. By isolating one chemical you do get a more potent drug, but you'll often, as you say, it can push things out of balance. For me as a herbalist, I think they're throwing the baby out with the bathwater, literally. You're actually losing a lot by isolating one chemical. But orthodox medicine wants everything isolated, they want it standardised, and in many ways you can understand that when you're treating a massive population and you have practitioners out there, you need to standardise the treatments to some extent.
But your treatments are standardised to a certain extent as well.
Well, yes and no. There are, the way that I would treat one patient might be completely different from the way that another medical herbalist might treat that patient. So there isn't a standardised approach to any condition. And that's the beauty of herbal medicine, is that it's much more creative. There's much more variation in what we can do, and we treat every patient individually. So say 10 people present to their GP with migraines, chances are those 10 people are going to get very similar treatment. But somebody coming to us for migraine, one client might get a herb in there to really help with stress. Somebody else might get a herb to help with the constipation that we'd see as being an issue with their migraines. So we're tending to treat everybody on a very individual basis. We tend not to use standardised remedies either. They tend to be whole plant remedies rather than us pushing to one particular constituent. So standardisation is very different, I think, in orthodox medicine to what we do.
And you actually make some of the medicines here. I say medicines, so they are medicines. You make them here as well, don't you? You mix them here.
We mix them here. We don't actually make the actual tinctures here, just because we're too busy to actually do that. But we buy all our tinctures in from GMP certified suppliers. Most of them are organically grown herbs. But what we do have is a dispensary with about 150 different tinctures, and then we can blend them, because they're liquids, together into a liquid medicine.
Yeah, and organic, that's important as well.
I think it's really important, yeah. I think you want to be getting herbs that are organically grown or wildcrafted, with consideration for the environment, because I think plants will grow at their best in the environment that gives them all the nutrients that they need. But we don't want chemicals and pesticides, etc., coming into somebody's medicine. We want it really clean and full of vitality. And a lot of the plants that are made into tinctures are done as they're fresh plants, so we're really capturing the essence of that plant.
Oh, that's brilliant. That's fantastic. Can we go and have a look at how you do it?
Yeah, absolutely.
Fantastic.
So the consultation lasts an hour, and during that time we're looking at the presenting health problem and overall health. And after getting a very detailed history, we write a prescription of herbs up. And there may be between 2 and 8 herbs in that prescription. Yeah. So using the tinctures means that we can blend medicines very readily. I've occasionally had somebody saying, can you give me a tablet? And I say, well, I'd need a tablet factory out the back there. So using tinctures gives us that immediate ability to formulate and dispense somebody's own bespoke prescription for their particular problem. So the prescription card comes out and we will select the herbs from the shelf. So say I was working with somebody with insomnia, I might use some humulus, which is hops, and we might also use some passiflora in that medicine. They might have some chamomile in there as well. And then we might give them some, let's see, some ashwagandha with Ania. So what we would do is we'd have a prescription written up with the quantities on there, and these would all be blended up into a bottle, and then the dosage put on that bottle for that client.
These are alcohol tinctures?
They're alcohol tinctures. By using alcohol, we can extract some of the active constituents. So some herbal constituents will come out in water, so they're water soluble. But some of the more potent constituents, things like alkaloids or resins, they need alcohol to actually extract them out. So the alcohol extracts out some of the constituents, and it also acts as a preservative so that the medicines don't go off, and it gives us a really long shelf life as well.
How long does it take you to mix it up? Do you do that when people are here, or do they have to come back?
They just wait for 10 minutes and we get the medicines made up for them, and they're ready to go. And they're really convenient to take, because it's only about a teaspoonful that you need 2 or 3 times a day to give you a really active dose. And because it's a liquid medicine, it's straight in. You absorb it very, very readily. It's very rapid absorption.
There's no need to digest anything.
No, it just goes straight, straight into the stomach and straight into the bloodstream. Yeah.
Oh, that's fantastic. And so this is exactly the same treatment that you would give to your normal customer, your normal clients or patients, that you would give to the low-income clinic patients.
Absolutely, yeah. In fact, the people that are coming to the community herbal clinic, they actually have a little bit longer for their appointments, because we do have the students taking their case history. We allow a little bit more time. They actually have a case conference afterwards, so we all put our ideas together. And then we make up our medicines exactly the same way as we would if it was our full clinic. It's just that the consultation fee itself is subsidised. I actually use the training fee that I get from the students that's paid to me to subsidise the cost of the consultation on the community clinic, rather than making an income from it as such. And that then means that people can pay, it's more than 50% less to come in. And what we are doing with it is we're not actually assessing people for their income. I think we want to make it something that people feel they can approach us about very readily. And, we accept at face value that they're coming to that clinic because they need to benefit from that concessionary rate.
That's fantastic. And so you're getting really, in essence, a pure medicine, if you like, that will work holistically and is really quite effective.
Very effective, yeah. I reckon about 85% of the people that come through my door get better. And they're coming through my door because they're not getting better through any other methods. So, the majority of the time with these sometimes complex conditions, or sometimes these problems that just aren't getting better with orthodox medicine, can respond really, really well to herbal medicine. And part of it is the herbs, part of it's the lifestyle recommendations, and part of it is just having somebody give you that time to really listen to what's going on and give you that empathic ear, which I think can make all the difference as well.
Yeah, and lifestyle is so important, isn't it?
Yeah.
And it's not just what you're putting into your body, it's what you're putting onto your body, everything.
Absolutely, yeah. I mean, I can remember very clearly a case where I had the chef came in to see me with this most awful eczema, and he was drinking something like 2 or 3 bottles of Diet Cola a day.
I knew you were going to say that.
Yeah. And he was inflamed, and he was inflamed emotionally, and he was inflamed physically, and he was really, really stressed. And, there was no point, if he'd gone to the doctor, he had gone to the doctor and he had a steroid cream. Now, what he needed to do was actually really look at his lifestyle. Now, chefing is busy and fraught. So what you need to be able to do is balance that out by doing something else. So some outdoor time, get rid of the cola, get some exercise in there, and actually eat properly instead of just supping away tasting dishes and not actually putting a proper diet in there. So that's the sort of thing that you would look at, is just really help people, address these areas where things have just gone a little bit off balance.
And how many chefs do we know that go out for a fast food burger after their shift ends?
Well, probably quite a few.
No, that's brilliant. So anybody can come in, you'll assess them, you'll give them what they need and support them.
Yeah, support them. We try and educate people. We try and get them to understand where the health problems may have come from. And often things are very deep-seated back into imbalances that go all the way back to childhood. So it's about education, it's about giving people choice, not just looking at what we're doing, but, educate them about orthodox medicine as well, what may or may not be good for them to be doing with their regular drugs. And looking at things like omeprazole, we try and encourage people to try and move away from some of these medications. In conversation with their doctor, we don't ask people just to stop drugs, but we try and encourage them to reduce their dependence on conventional medicine when they can, because I think that's really important as well.
Brilliant. Thank you very, very much. Well, I hope people will come along and take advantage of this fantastic clinic.
Well, we had our first one at the weekend there, and we had several clients through the door, all very positive about what the students were doing, and it felt great to be able to open up that access to what we're doing here, because herbal medicine has always been the people's medicine, and this makes it more so.
Brilliant. I love it. I love it. Thank you very much, Keren.
Okay, thank you, Gigi. Okay.